Good morning, everyone. It's a pleasure to be here. I'm Amy Liebman from the Migrant Clinicians Network, and I'd like to just piggyback onto what Layla talked about and think about some of the social justice concerns and some of the policy implications around that. Can you go to the next slide, please? So Migrant Clinicians Network is a national organization. We've been around since 1984. And we work on creating practical solutions at the intersection of vulnerability, migration, and health. And we envision a world based on health, justice, and equity where migration is never an impediment to well-being. We do a number of programs from advocacy to research to program interventions, but most of our work supports providing training, education, and technical assistance to community clinics and community organizations in order to improve healthcare access and healthcare quality for our immigrant and migrant workers and their families. Next slide, please. I'm speaking to you today on behalf of both Migrant Clinicians Network and the Marylanders for Food and Farm Worker Protection. And this is a broad and diverse coalition that uses advocacy groups, organizing, public education to win back basic health and safety rights and protections for poultry workers, crab pickers, farm workers that are vulnerable because of our food system. We are working on a number of different efforts together, looking at mandatory worker protections in terms of state emergency temporary standards, particularly around COVID, improving data collection for infectious disease outbreaks, focusing on industry and occupation, looking at a protective heat-related illness standard, and also emergency preparedness plan for infectious disease outbreaks. Next slide. So with that introduction of our two organizations, I want to focus on just who are our food and farm workers. And a lot of the photos that you saw in Layla's video and in this presentation are done by Earl Daughter. He's a Marylander, and we've done a lot of work together, particularly on the Eastern Shore, looking at the different occupations that our immigrants contribute to. Next slide, please. So our immigrant and migrant workers, our food and farm workers are largely immigrant and migrant. About 3/4 of them come from another country. Their English proficiency is limited, and they speak largely Spanish, Haitian Creole, or even indigenous languages. Their immigration status is mixed. You heard Layla talk about H-2A workers or H-2B workers. So basically what we're seeing is a group of workers. Those who are working in agriculture can be here with a certain kind of temporary visa. And those who are working in our chicken plants have other kinds of work authorization. And those working in our crab picking plants also have different types of visas. Many of our workers also do not have legal authorization to work in the US. So that depending on visa status, that makes them can increase their vulnerability quite a bit. And even those with visas are very concerned about being able to work and not wanting to cause any problems and not wanting to leave their job site for any reason because they're here to make money. But immigration status becomes very important when we look at worker rights. Also, a lot of our immigrant workers and migrant workers have lower levels of formal education. It doesn't mean that they're dumb. It doesn't mean that they don't have a lot of education that's particular to the work that they're doing, but the formal education in terms of formal schooling, they don't have, and literacy levels are low. Next slide, please. So I want to talk now, that's just a general overview of sort of the demographics that we're talking about, but just thinking about sort of what are some of the risks that these workers face on their job. Pesticide exposure is a really important risk, both for our farm workers who are working in harvesting and our food, as well as those also working to process our meats. This coalition, the Maryland Food and Farm Worker Project that got together, we originally got together early in March 2020 when we were concerned about farm workers being provided adequate respiratory protection to protect them from pesticides. And so when we think about this pesticide exposure, I may be coming at it to you today from a very much a worker health and safety standpoint, but having workers properly treated, properly educated, properly protected, and trained on how to use and apply the pesticide has a really important impact on our environment and the bays, because when pesticides are not applied properly, or sometimes in cases when they actually are, we still have a lot of runoff into the Chesapeake Bay. So really, the way that we like to think about it is that when we're looking at farm worker protections, we're also looking at protections that ultimately are going to protect our communities and our environment. Next slide. Another really important risk, and it's growing in Maryland and across the country, is heat-related illness. And farm workers are 20 times more likely to die from heat-related illness than other workers. So getting a strong protective standard passed for or implemented for farm workers is going to be really important in this coming year. And just a note on heat-related illness and pesticides is that we have a lot of concerns about what it will take to protect workers from pesticides interfering with what it will take to protect them from heat. So that's an issue that we really try to balance to make sure that we're not overheating our workers, but keeping them protected from both heat and pesticides. Next slide. In addition to pesticides and the heats, there's a number of other risks and hazards that our workers face, from crowded housing to crowded transportation to unsafe transportation. Pesticides I've already mentioned, but there's also other chemical exposures, all kinds of injuries, infectious diseases. I always put carbon monoxide poisoning in there because we forget sometimes that when it gets really cold, and it does in many of our workers' housings, that sometimes using other types of heating sources can cause carbon monoxide poisoning. And then our worker population is not immune from all the other chronic illnesses that the rest of our standing population faces, but because of their work, it may be very hard to help manage that, like diabetes and taking a break to sort of address your insulin. All those are really important factors impacting workers on the job. Next slide, please. Our poultry workers, or our protein processors, those in the seafood industry, they face a number of really important risks on the job. Layla mentioned some of them, but as a result, we're seeing high levels of musculoskeletal disorders, from back strain to carpal tunnel syndrome. They are exposed to chemicals and pathogens, and most of the disinfectants that they use are also registered pesticides, and these disinfectants and the use of the disinfectants increased substantially during COVID. So exposure to them is a really important concern, and wanting to make sure that we're addressing that is important. Also, there's traumatic injuries from machines and tools that result in not only lacerations, but amputations. Next slide, please. So we're looking at a population because of who they are and who and their work are made more vulnerable by these circumstances. There's like cultural and language differences that are really important. They're often entering into occupations that are low wage, so poverty are important issues. The inherent dangers and health risks in their job make them particularly more vulnerable. I talked a lot about immigration status already. Many of our immigrants are folks that are here living in our communities and working, but others are migrating back and forth between their home country or their home state to Maryland to work. And that poses a whole set of other vulnerabilities. The lack of access to healthcare, health insurance, and other financial resources make them more vulnerable. And then most importantly, I think one of the things that this group might be concerned of is that this is a group that is systematically working with regulatory protection that is not afforded to other workers. Next slide, please. So there's, particularly for our farm worker population, it's a little bit different when we look at our farm workers who are working in the field versus our poultry workers. There's some different types of regulatory policies around them, but there's some crossover. But with farm workers in particular, there's been a long history of what we call farm worker exceptionalism. The laws that protect all of us in our workplace some of the labor laws that started in the 1930s, farm workers have been systematically excluded. So the Fair Labor Standard Act from the 1930, which brought about minimum wage, overtime, got rid of child labor. Farm workers were by and large excluded from that. And there's been some changes at the state over the years with that, but they continue to sort of address the challenges from the 1930s of laws that protect all of us that they're excluded from. Workers' compensation is different for agricultural workers. There's only 14 states that require employers to provide the same type of workers' compensation to agricultural workers as to other workers. That when we look at the agency, that's made responsible to keep help workers have a safe and healthy workplace, or OSHA, the Occupational Safety and Health Administration, they have very few standards that are aimed at specifically at farm workers. And a lot of the pesticide related regulation is not even in the agency that's charged with worker health and safety. It's in the agency that's charged with regulating pesticides. So there's definitely like a regulatory conflict of interest in and of itself by having the EPA be responsible for farm worker protection when it comes to protecting workers from pesticide exposure. Next slide, please. So on any given day prior to the pandemic, we were looking at a workforce that was made vulnerable by a number of different reasons. The pandemic comes and all of a sudden, these workers who suffer injury and exploitation on their job are now deemed essential workers. We had our farm workers, the meat and chicken and seafood processors, dairy workers, all were deemed essential workers. Next slide. That meant they had to go to work and they couldn't work from their living rooms or their bedrooms like many of us did. And it should be no surprise to this group that more than 70% of the immigrants in the United States actually worked in jobs that were classified as essential. Next slide. So it's not surprising that COVID-19 impacted our Black, Indigenous, Latinx, and immigrant communities and people of color more so than our white population. If we're looking just from the CDC data on Hispanic or Latinx in comparison to the white non-Hispanic population when it comes to COVID, we're looking at the infection rate 1.9 times higher, a hospitalization rate 2.8 times higher, and a death rate 2.3 times higher. Go to the next slide, please. And this is just the Kaiser Family Foundation put those stats for all of our different ethnic and racial groups into a chart, and you can see that our Black, Indigenous, Latinx, and people of color are more disproportionately impacted by COVID-19. Next slide. I always go to Purdue University before I do a presentation like this. They have a really great dashboard that they have these estimates that they look at. And we're really seeing that about 936,000 ag workers have been infected with COVID-19 since the start of the pandemic. Next slide, please. So one of the challenges that we have with when we look at the food and farm workers is that we have somehow meshed public health policy with what we consider worker benefits. And really what I want us to start thinking about, and as we sort of think about policy change, is that what we think of traditionally as worker benefits are really public health policies. And we were really hurt during this pandemic because we didn't consider them public health policy, and we still don't. And so when it comes to paid sick leave, you want workers to be able to quarantine or to isolate as needed, but they should also be compensated for that time. Limited testing and few requirements about testing. That's not a worker benefit, that is a public health policy. The limitations in personal protective equipment, housing and transportation, all of those sort of we tend to look at in the workplace as worker benefits, but we need to shift our focus to thinking about these types of policies as benefiting public health and not just individual workers. Next slide. And in addition to the lack of policies, which really impacted these workers and impacted why they were so drastically impacted with COVID-19 in the workplace, we also had a lot of rhetoric from politicians, from media, from others that place the blame for COVID-19 on the workers. There were quotes in the media about like their home and their social conditions were the cause of the meatpacking outbreaks. Oh, it was their living circumstances. They were just so crowded in certain cultures. They go to school and work in buses and they're all packed like sardines. All of this was to take the blame off of what was happening in workplaces and put that blame onto individual workers. And again, doing that, I think supported lack of public policy that ultimately would have better protected not only workers, but also our public health. Next slide, please. This is a quote from a colleague of mine, Jorge Chavez, from the Coalition of Immokalee Workers. Many of the Coalition of Immokalee workers, they work not only in Florida, but they also come and work here in Maryland on the Eastern Shore where I am in the summer harvesting and tomatoes. But farm workers say, you hear the job that we do is essential, but you realize as a worker, you're not treated as essential, you're treated as dispensable. Next slide. And this is a quote from MCN's former board chair, Dr. Evra Galvez. She is a physician working in the Virginia Garcia Health Center. She was interviewed by the New York Times, and where she was talking about how challenging it was to help protect the workers that she was caring for when there were not regulatory protections in the workplace. And she saw throughout COVID the impact of what it meant to not have regulations that were protecting workers in place as COVID was sweeping through the farm worker communities that she was caring for. Next slide. So what are the regulatory and policy solutions that we need to be thinking about? Definitely temporary standards and emergency orders. Obviously, I think there's a lot of challenges in getting them in for the long term, but ultimately we would like some longer term ones. But let's face it, every day we wake up and we look at the news, we are looking at a pandemic that doesn't seem to want to leave us. And so workers still need to be protected. We need to have regulations in place that is going to talk about helping to get workers vaccinated, helping them to leave and get paid if they need to get vaccinated or recover from side effects, and for reporting to happen if there are outbreaks or breakthroughs in the workplace. We still want to make sure that workers are provided with the proper protective equipment, that physical distancing remains in place in many workplaces, that proper and safe disinfection takes place so that workers are protected, that workers, particularly those who are not vaccinated, but workers also participate in testing so that we can make sure that we're not creating an outbreak or exposing other workers in the workplace. Looking at changes to housing and transportation in order to reduce the spread of infectious disease, and also really important, but paid sick leave is also a critical piece to some of these policies that are needed. Next slide. In Maryland, we've been working really, really hard to get improved surveillance in data collection. And we really want to see industry and occupation included in understanding the COVID-19 outbreak. So as data is collected in workplaces, as data is collected, if they're through contact tracing, through case investigation, really understanding the industry and occupation is critically important. Why is that so important? Again, it's public health policy. You can't have public health, you can't have good public health without improved surveillance, and you can't have that surveillance if you don't have the data. And so in many ways, we were flying blind in Maryland because we did not have stronger standards in place, which looked at reporting of workplace outbreaks and really understanding the work relatedness of COVID-19. And in places around the country like Washington State and Puerto Rico, where we did have improved documentation, we were able to see much more clearly what we know what was happening was the work relatedness of the COVID-19 outbreaks. Next slide. And at the end of the day, what we're looking for in terms of the risks that our workers face in the workplace, whether it's around pesticide policy or COVID-19 and the emergency standards and the regulations that we need around that. Our food and farm workers deserve a safe and healthy workplace.